Welcome to the OR Today webinar series. We're excited to have over 200 registered attendees for today's webinar. Just a reminder that our 4th annual OR Today Live Surgical Conference will be held August the 26th to 28th in Nashville, Tennessee. Registration is now open. If you use promo code ORTEARLY, that's ORT early, you can save $50 on your registration. So for more information, please visit ortodaylive.com. Okay, let's kick off today's webinar by giving an OR Today Live surprise pack to the attendee that can tell me in what US city is the largest St. Patrick's Day parade held. Answer now using the questions feature on your dashboard. While you're answering, I want to remind you today's webinar is eligible for 1 continuing education hour. To obtain your certificate, you must complete the post-webinar survey, which will appear immediately on your computer screen at the end of today's call. 1 lucky attendee will have the opportunity to win an Amazon gift card courtesy of OR Today, just for completing the survey. Okay, and the winner of our OR Today Live surprise pack is Jana Piri. Congratulations, Jana. The correct answer is New York. OR Today would like to thank our sponsor, Encompass Group. Encompass Group is one of the leading manufacturers and marketers of reusable textiles, professional apparel, disposable and single-use medical products. Encompass Group believes that every patient, resident, caregiver and family member should feel safe and comfortable in today's healthcare environment. Markets served include acute care, long-term care, senior care, retail healthcare, apparel, hospitality, and government operations. For more information, visit encompassgroup.net. Our presenter today is Angie O'Connor, Director of Clinical Resources at the Encompass Group. Angie, you may begin whenever you're ready.
Thank you very much, and welcome everyone to the webinar entitled Back to the Future. New Innovations in Reusable OR Textiles. Reusable gowns and drapes were the standard in U.S. operating rooms prior to the 1980s, but at that time, with the introduction of bloodborne diseases, we had a dramatic or rapid shift to disposables in the OR at that time, and they really became the standard. Over the next 45 minutes or so, we're going to talk about the technological advances in OR textiles that have made them the product of choice actually throughout Canada and Europe now. And so I will be referencing that throughout the presentation because they have seen the value in the reusable textiles, and that gives us reason to really give another look at reusables for use in our operating rooms. These advancements can change how reusable textiles can provide safe and comfortable solutions to our operating room, but also we can provide environmental and cost benefits as well. So in looking at our learner objectives, we always want to remember in this presentation that we'll be comparing reusable and disposable drapes, gowns, and mayo stand covers. So we'll look at safety and comfort features between these. We'll look at specific requirements and performance standards for barrier protection in the operating room. We'll differentiate the cost associated with the use of each. We'll outline the environmental impact of these, and then discuss considerations for you in the event that you would want to look at an evaluation of reusables versus disposables. So OR is the biggest user of medical supplies in the entire institution, and for many, many years, AORN has been calling for the greening of the OR. When we make a decision to use disposables or reusables, there are a lot of factors that we need to take into consideration, and we'll talk about that. These factors can, affect the comfort and the cost. There are also environmental considerations, and also steps that you really should consider when looking at these options. So with that said, let's go ahead and get started. I like to always begin with a little bit of history when we look at working in the operating room. Where did it all begin? The age of aseptic surgery, as it's called, came from the works of Pasteur, Lister, and Koch. In the late 1800s, this is where we really saw the development of standards or practices that are just commonplace in the OR today. This is where it was determined that the surgeon's hands had to be scrubbed, his instruments must be boiled, and that the wound drapes had to be rendered germ-free. So this is where we really saw the introduction of freshly laundered, sterile gowns, drapes, etc., or the emergence of reusables. With these textiles, they would use one or more layers of sterile cotton sheeting or muslin, and this was a practice well into the 19th century. Then in about 1952, Beck and Collette discovered that when these textiles would get wet or dampened, they lost their ability to act as a barrier to microorganisms or bacteriological types of things. And so this is where they started introducing properties to textiles in an effort to create a barrier, if you will. And eventually we saw the emergence of Gore-Tex. Then in the 1980s, we saw the emergence of the bloodborne diseases. HIV particularly was one big one, and we saw an immediate shift from reusables to single-use devices. But what resulted with that, or a side effect of that, was that we saw a dramatic increase in waste production, which then led to a number of other issues that we have with waste disposal, etc. Today's reusable textiles are really not those of that time in the 80s or those that dated prior to the 80s. They're a high performance product. They have proven test methods for barrier efficacy, and it provides clinicians with textiles that really deliver superior protection, comfort, and they're really easy to use. When we're looking at selecting or perhaps trialing these products, there are a lot of things that we need to take into consideration. All surgical gowns and drapes must be registered with the FDA to demonstrate their safety and effectiveness. So when we choose a drape or a gown, you have to find that balance between safety and comfort, but we always know that the most important criteria is the safety for the patient and the perio personnel. Gowns and drapes have to provide an effective barrier against the transmission of microorganisms for two reasons. First, we have to protect the patient against contamination that can result in a post-op wound infection. And then we also have to protect the surgical team and other healthcare professionals so that we're not transmitting bloodborne pathogens or other microorganisms. Gown comfort is also very important, as we know, particularly for those longer surgical procedures. And when we talk about cost, a common comment that I hear from individuals is that reusable textiles are so expensive. Well, I hope that during this presentation I can shift your focus to cost per use as opposed to purchase price, because you'll see there are some real benefits when we factor all of those issues in. Often, too, as the end users, the environmental impact is overlooked. Once those items leave our department, it's kind of an out of sight, out of mind type of perspective. But we're going to see that the environmental impact, disposal costs, it all is being allocated somewhere. It may not, those costs may not be hitting our department or our budgets, but it's showing up somewhere. So we'll show how we can actually see some improvements in those areas as well. So let's talk a little bit now about safety and barrier protection. It's important that we know that both single-use and reusable surgical gowns and drapes are governed by the same regulatory standards. These standards cover performance claims, care and handling, labeling, and overall safety practices. Sometimes you hear that there's a perception that there's a more stringent standard for one or the other, but they're not. They're actually identical, which is a good thing for us. Angie and Amy in 2003 actually developed these standards for barrier protection. The ANSI-AMI Protective Barrier 70 standard actually is a liquid barrier performance and classification. It's a protective apparel and drapes and intended for use standards in healthcare facilities. Again, it was developed in 2003, and then it was also updated in 2012. So this standard is really important because it establishes a system of classification for protective apparel and drapes used in healthcare facilities. And it's based on their liquid barrier performance, which is important. That's what helps us to be protected from fluids that we're exposed to in the operating room. It also specifies labeling requirements and standardized test methods. This chart I like to share. It's just something that I pulled together, pulling from some different sources, but as you can see, there are levels 1 through 4 with the protective barrier standard, and 1 is minimally invasive types of procedures where we don't anticipate that we're going to get fluids or splashback. And we go down to level 4, and you can see that that's a full hands and body cavity, trauma, cardiothoracic cases, open abdomens. And probably the biggest point of discussion that I hear around this slide when I'm presenting at AORN at the surgical conference, for example, is, I ask the nurses, what level of peri-op gown are you using in your OR? And some know and many do not. And so I really encourage folks to use this slide as a point of conversation. Take it back to your department and look at the types of cases that you perform. The last place as an OR team that you want to end up is having a level 2 or level 3 gown, and then have something happen during that procedure where all of a sudden you're going to open that patient up, and all of a sudden we should be in level 4 protective gowns and have that in our drapes, etc., but we're only in a level 3 or maybe a level 2, for example. So I just encourage you to take this back, understand what you're using. I can say that I have had some conversations with colleagues in Canada, and generally they tend to lean towards the level 4, primarily for staff protection. Should something occur where they shift from a level 2 or 3 to a level 4 situation, they want to be sure that their staff and the patient is protected in that situation. Let's shift back to comfort, and this slide was published in the AORN journal in 2010. The whole goal of this study, which was conducted actually in 2 large hospitals in the ORs in Washington, D.C. in 2010, and they wanted to look at the comfort, ease of use, and protective properties of reusable versus disposable surgical gowns. What they found was that most surgeons in the techs preferred the reusable healthcare textiles at levels 2 and 3 for shorter procedures. They also found that for longer procedures, almost all of the OR personnel overwhelmingly rated the reusable level 4 gowns as very comfortable because of the breathable laminates that are in these products. 86% of the participants rated the comfort of the reusable gowns as superior. And when they asked them about the ease of use, the reusables were rated superior by 87% of the participants. The interesting thing was that out of all of the folks that participated in this, only 6% rated the disposable gowns as superior. So looking at this information, what this says to me is that, we've been using reusables for a long time, but because of the advancements in the technology with the reusable gowns now, we're really finding that they're very lightweight, comfortable, breathable, but yet have those safety standards that we're all looking for. So they're definitely worth taking a look at again. So as I mentioned earlier, there are many issues to look at or take into consideration when we're looking at considering a reusable drape or a gown versus a disposable. Cost per use is a big one, and again, when you look at purchasing a reusable item, you know, it may be, or the perception is that purchase price is significantly higher than a disposable. But the thing that's important to know is that for most of our reusable textiles, they are in use for up to 50 to 75 uses. And so when you break out and look at a cost analysis as cost per use, they're typically less expensive than a single-use disposable item. Part of the reason for this is that reusables are processed by third-party laundries or commercial laundries, and because of the volume of healthcare textiles that are processed there, you see real economies of scale with that. There are regulated waste and disposal costs, and one of the largest costs associated with disposables would be the disposal of the OR textile and the waste disposal. So those are costs that can be hugely reduced if you're shifting to reusables. There are unused items that are in our packs that we're just throwing out, pitching out, and if we have a custom pack, those are all really nice, but we all know that it takes time to create those packs, and if changes come down the pike, it may take us a long time to actually redesign those custom packs. So as a result, we end up with a lot of waste that's just pitched before or after the case. There are hidden factors that are involved when we're looking at reusables versus disposables. One is the number of handling steps, recovering instruments that are wrapped up and thrown away in disposable drapes, for example. Not having to double our table covers or mayo stand covers because we're concerned that heavy instrument trays, for example, may rip or tear the disposable drape. And every time you have to add a second layer, you're adding cost to your procedure. And then also savings in water and energy are important. And environmental impact is important because this all ties into the waste management, which we see, again, a lot of disposal fees with the disposable items. So we're going to take a quick look at cost per use, and this is looking at a reusable gown versus a disposable gown. Now you can see the initial cost. This is where I think people get the perception. This reusable gown, the purchase price they're saying was $60, as opposed to the purchase price for the disposable gown is $4.50. But if you look at 50 uses for that reusable gown, then the purchase price comes way down to $1.20 per use. You add in these other costs associated with both of these items, and you can see that the cost per use is under half of what the cost per use is for a disposable gown. Now, I've had some conversations with folks that run the pack rooms for reusable OR textiles. There are some costs that are added in here that the major thing that's not reflected is replacement costs. And sometimes you end up with, inadvertent cuts, tears, or surgeons decide to take scissors to something, and they have to build in a replacement cost to the reusables for those damaged items. But it really is established that in spite of those things, the reusable programs are cost saving and less expensive than the disposable programs are. Because most of our things in the OR are disposable, with the exception of we have a pretty high utilization of bath blankets there, but we don't have much exposure to the commercial laundries or what that looks like. And so I like to just share a little bit of information about that while we're on the topic. At most hospitals, laundry and sterilization are actually contracted out to an external vendor or a third-party processor. It used to be that a lot of these functions were performed in-house, but now it's less than 1% of facilities actually have their own on-premise laundry. Reusables, unlike the disposables, we pitch them, but with the reusables, they're processed after each use. And they have the ability to assure that the product is safe and performs properly throughout the life cycle of the product, so that 50 to 75 uses. So how they do this, each time the item is laundered, it goes through an inspection process. It passes over an inspection light table, and this allows them to determine if there are any tears, puncture holes, etc. They check the integrity of that item. It's pulled out of circulation if there are any problems at all, and it's actually repaired and returned to circulation if it meets the quality that's expected. Each pace is actually tracked as well with an RFID chip or a barcode. This way it allows them to make sure that that item doesn't stay in circulation longer than it should. So the thing that's important to know about the reusables is that each time the garment's used, it's inspected and assured that you have a quality item and that it's safe for use. And this brings a lot of comfort, I think, to the team. It's very important to know that it's a high standard with the inspection of these garments when they come through. So when we look at the costs associated with waste removal, there are a lot of challenges around this and looking at disposal of regulated medical waste. One of the biggest challenges that are faced by hospitals is being compliant with state and federal regulating agencies such as OSHA or the Department of Transportation. Many times the state law will define the regulations on how the hospital must handle and dispose of their regulated medical waste. The regulations are stringent and there are hefty penalties if they break these regulations. The regulations focus on collection, transport, and disposal of medical waste. As you can see on this slide, disposal of the regulated medical waste is estimated to be up to 8 times that of normal solid waste, with an average cost of being about 28 cents per pound. So very costly, as you can see. At one point, old practices would be that hospitals had on-site incinerators, and they would actually just burn everything that would be deemed hazardous or medical waste. And they found very quickly, though, that they were exposing the public to a lot of toxins like mercury, dioxins. Other highly toxic substances were just being spewed out into the environment. So by 1997, they established new regulations, and the majority of these big incinerators were actually shut down. So nowadays, currently most healthcare facilities either ship their waste to large centralized incinerators, or they use technologies other than incineration like steam autoclaves, microwave systems, dry heat, etc. And they actually sterilize that medical waste prior to disposing of it, and then it's returned to the standard municipal solid waste system. Excuse me. So you can see that this is one way they've gotten around this process. We talk about the hidden or intangible costs. Excuse me, getting a little hoarse here. Studies have shown that reusable linens actually require fewer handling steps than disposables. AORN did a survey, and what they found was that the process of ordering, transporting, and delivering sterile disposable gowns and drapes had 6 additional steps as compared to contracting with a third-party laundry for reusables. So we know that whenever we have extra handling steps, that's dollars, that's money, that's employees that are having to deal with that. And so that's really an important thing to think of. It might be convenient disposing on the other end, but there are other costs that are built into that. I tell people too, for those of us who have worked in the operating room, recovering instruments is huge and tremendous. And when we had the shift to disposables, there are just massive amounts of instruments that go out into the trash with our disposable items. The University of Maryland Medical Center moved to a reusable textile program more than 15 years ago, and they estimated that in 2010 they saved approximately $39,000 in replacement costs for instruments just by having that relationship with the laundry. So what happens with the commercial laundry is when you send your drapes, gowns, etc. to the laundry, everything is sorted. And so anything that is pitched, instruments, equipment, we've had many instances where jewelry is actually sent off. A commercial laundry is able to retrieve a surgeon's really beautiful wedding ring that was pinned into the inside of her scrubs. So anything that comes through with reusables is actually sorted out and returned to the facility. So that's a source of really big cost savings. I talked about the non-doubling of the mail tray and back table covers, which when you don't have to do that, it's a cost savings. And then we also have water and energy use, which is minimized as well through the commercial laundries. They're always working to find an efficient and effective, cost-effective way of reprocessing these linens. So this slide was just shared with me this last week, compliments of Brendan O'Neill, who's the Director of Corporate Development, and he is at the London Hospital Linen Service in Ontario, Canada. These are pictures of just the instruments that their laundry recovered over the course of about a month. And so you can see that there's a lot of money there before you. And so shows also the opportunity to really save cost with replacement of all of these items. Very important relationship that's beneficial to everybody involved. So when we talk about life cycle analysis, in 1998, the CDC actually hypothesized that there was no difference in the life cycle impacts between reusable and disposable gowns. So they look at kind of the cradle to grave for these gowns. So the entire manufacturing process through use, through end of life and disposal, etc. Dr. Overcash reported that since 1993, there have been 5 life cycle studies of protective surgical gowns, and none of these studies actually support the CDC hypothesis. And Dr. Overcash just completed a new study in 2017. We had the pleasure of hearing the results of his study presented at the ALM Impact Conference this week. And here's what he found. If you look at the natural resource energy that is saved by using reusables, there was a reduction by selecting a reusable system of 65% of those natural resource energy items. Global warming potential is a little less easy to measure, but there was a 66% reduction there. Blue water consumption, 88% reduction. In solid waste generation, 83 to an 86% reduction. And so for these items, again, in the OR, those are sort of out of sight, out of mind for us, but we have to realize that when we have energy, resources, water, solid waste generation, there are costs associated with the utilization of those resources and with disposal of the solid waste. And so those costs are being assessed somewhere. So again, I think it's really exciting that Dr. Overcash's study does still validate that the reusable systems are far more beneficial from this perspective. Again, with environmental impact, within the hospital ORs, it's no surprise, we contribute disproportionately to the healthcare waste stream. Although our ORs occupy proportionally a smaller area of the hospital, we're responsible for 20 to 33% of the total hospital waste. And I think for those of us that spend time there, we're not surprised by that number. They say that, in fact, one routine operation at a hospital produces more waste than a family of 4 produces in an entire week. So carrying on that theme, in Canada, Stahl and colleagues estimated that a total knee replacement, they measured the data, this was back in 2008 through 2009, again, just for that total knee replacement. Those procedures produced the equivalent landfill waste of 2,000 garbage trucks by volume. And they stated that the disposable surgical linens consisting of gowns, drapes, and table covers contributed disproportionately to that volume. So what's very alarming to me is that, as I mentioned in the beginning of the presentation, you know, Canada and Europe are now primarily a reusable system. We're the complete opposite, so I shudder to think at what our volumes could look like here in this country. Again, too, we have AORN. They have an official position statement about the environment, and they clearly state that our peri-op practices should include selecting reusable equipment and materials, and they actually mention drapes and gowns that are of a quality equal or superior to one-time use items. So once again, we have AORN standing behind us and supporting these transitions. Slide, this gives a very high level perspective on 4 facilities that have taken bits and pieces of their programs, converted to reusables, and sharing what types of cost savings they've realized. Winter Haven Hospital in Florida actually converted to a reusable surgical textile program in 2001. What they learned was that within 5 years, the cost savings were found to total $625,000. So, you know, there were a number of pieces that they implemented with this, but you can see that cumulatively there's a big impact there. A life cycle analysis of AMI Level 3 surgical gowns used at the University of Minnesota Medical Center Fairview found that using reusable gowns instead of disposables would save 254,000 pounds of waste per year at a cost savings of $360,000. Kaiser in San Diego reported that its use of reusable surgical gown and basin sets reduced the organization's regulated medical waste by 30 tons at a savings of 3.8% in 2010. And then lastly, we have the University of Maryland Medical Center coming in and reporting that it avoided disposal of almost 139,000 pounds of waste as a result of using reusable supplies. They estimated an approximate savings of almost $39,000 in avoided waste disposal fees. So you can see that different facilities are taking different aspects of a reusable program, but they are realizing a significant cost savings in their use of the textiles and also reducing their disposal fees as well. So I'm going to touch at a very high level on the evaluation process. Most facilities now have either a value analysis committee or some form of a committee that your trials or purchase decisions have to be approved by. So it's important that we establish a multidisciplinary team so that we're sure that we're providing good, solid data to a value analysis committee that allows them to make good, solid decisions. We always want to include the end users, of course, the peri-op nurses, the scrub tech surgeons. The laundry processor will be a big, big partner when you shift to a reusable program. They will have the pack room that will, you know, essentially reprocess, clean, wrap, and perhaps even sterilize your items for use in your OR. So they will be a key partner that you want to have involved early on. You'll need to look at financial perspectives, facility management. I really encourage people to bring infection preventionists in. I think there's a perception out there about healthcare textiles and how that relates to potential infections, et cetera. And this is an opportunity to show them how far the textile industry has come and how safe their processes are, and how we can really provide quality products that really suit their needs and meet their standards for infection prevention. Supply chain is important, and also EVS, because EVS will be involved in your linen handling, if you will, with reusables in your OR. The next step is you want to gather information and do your research, and you don't need to reinvent the wheel. Your vendors will be very helpful in providing information on performance and processing and care for the garments. The laundry service, again, will be a very, very instrumental partner. You want to do literature research on reusables versus disposables, and AORN, Practice Green Health, there's a lot that's published out there. You'll want to know the environmental issues in your area. What are those state and federal regulations around regulated waste? And then also reach out to colleagues. Again, you can find people who are already doing this and prevent you from starting from scratch. You know, take advantage of their experiences and their wisdom. And then next, you want to establish a solid evaluation tool specific to this project so that you're providing consistent feedback and data and including information that's really important to help you to make this decision. You'll want to be sure that you understand your baseline of costs. You want to know what your targets are to reduce waste in your facility. Someone in your facility is well aware of the costs associated with disposing of all of these items in the OR. And what are your goals? What percentage of reduction might you like to see as a result of making a conversion? You'll want to look at your compatibility with the other products that you have, and you also want to understand your current OR practices and the staff's perspective on comfort and safety. Financial impact is huge, we know, because of all of the focus on reducing our costs. And so you want to just be sure that you include costs associated with every aspect of the use of this product. Direct costs, staff time, acquisition costs. You're going to have to look at, you know, storage, what's required, what your inventory should be. Reprocessing and laundering costs will be provided by your commercial laundry partner. And then again, those disposal costs and requirements for your area. Be sure that you have a plan for conversion prior to even doing all of this. The worst thing that can happen is to run a trial, make a product choice, and then discover that you might have pallets of the old product in a warehouse that have to be utilized before you can make the conversion. You want to make the conversion while the staff are trained, everyone's excited, it's fresh in everyone's mind. And so be sure that you think through this process before you look at implementation dates, etc. Conduct an environmental impact analysis, and this again is the information that we've been talking about with the life cycle assessments. I'm going to talk briefly on the environmentally preferable purchasing programs, and also understand the volume of disposables used in your OR and the associated costs that you're currently paying for those. So this is just briefly high level on environmentally preferable purchasing policies and practices. In an effort to reduce waste, AORN partnered with the EPA in a number of states and organizations, and they recommended adopting environmentally preferable purchasing policies and practices. You can see the 5 points that have been established here. The EPA actually developed these, but they're very easily applied to the peri-op area. Pollution prevention should be aimed at preventing the risk both to human health and the environment. We often think of environmental impact, but if we have pollutants that are being released into the environment, either through water or air, then that has a direct impact on the patient population as well. Purchasing agents should consider environmental impacts of the product throughout its life cycle, so not just at the point of use, but this gets back to the life cycle analysis that we talked about with Dr. Overcash's work. And then we should compare environmental impacts of differing products as we've done with the disposable and reusable OR textiles. So if you want to know more about EPP, You can Google look this up, but it's really recommended so that when you make these purchases, you always have those impacts in mind, driving each decision that you make. And then lastly, you're going to, once you've done all of this work up front, and it does seem like a lot of work, but once you have all of your information gathered, have your plan established, your buy-in from everyone, then you conduct a product trial with the support of your team, your commercial laundry, the vendors, and select your product. And then lastly, it's really important that we don't take that product, put it into our departments in our OR suites and not monitor. It's very important to monitor, have a champion who is overseeing the process, and be sure that you're collecting the input or feedback from the staff, and the good and the bad, and should anything come up, understand how you're going to address that immediately. This is how these facilities are recognizing or realizing these cost savings, is that they're establishing a good solid plan. And then once they've started with usually an item or two, then they'll expand that and increase the cost savings that they're experiencing. So we always want to be doing process improvement. So in summary, safety is always very important. We want to be sure that we're ensuring the safety of our patients and the members of the peri-op team. The purpose of this, obviously, is to minimize the risk for transmitting pathogens to either of those parties. We know that prior to the establishment of the national standards in 2003, there was no objective basis for selecting OR textiles based on barrier properties and other testable measures. But now we've got the exact same regulatory standards covering performance claims. These standards cover care and handling, labeling, and overall safety practices. And they apply both to single-use and reusable OR gowns and drapes. The advent of sterile disposable items in healthcare over the last 30, 40 years, they've served their place. They certainly helped us back in the 80s when we had the emergence of all of these bloodborne pathogens. But now I hope that the information in this presentation has shown you that we've had significant improvements in quality. The cost-benefit analysis is very clear that our cost per use is significant and can help us to save money. And our life cycle analysis shows that there are clear benefits to the environment when we use reusable surgical textiles. In addition to this, our studies now consistently show that the peri-op personnel find the gowns to be more comfortable, especially for their longer cases. So by understanding these characteristics, this is where we say that the peri-op nurses can now go back to the future in providing a safe environment of care for both their patients and their coworkers. So with that said, that concludes my presentation, and I will welcome any questions that we have now.
Okay, thank you, Angie. Yes, we've got quite a few questions. The first one is, what feedback do you get from peri-op nurses when discussing reusable textiles in the OR?
Well, the first thing that usually comes to mind is, their perception is that the cost is very high. I think for nurses who have been in the environment for the majority of their career, their perspective is that the reusable textiles are very heavy, that they're not comfortable, that they're not breathable. And we know that with the technological advances, that just is no longer true. We can overcome that easily. And then it's always, of course, the surgeons. But, you know, coming from that environment, I would say that in many issues and challenges that we have in the OR, we always have the surgeon's perspective that we have to work with and gain their trust and approval. So those would be the common things that I typically hear about.
Okay, so what is one of the first questions that should be asked when exploring reusable textiles in the OR?
Well, I think probably the primary thing that is key in any situation is, do you have in your area the ability to process and sterilize the items? They need to be handled in a pack room at the commercial laundry, or if you have an on-site laundry facility, do they have a pack room? Do they have the ability to help you with this program? And we do have commercial laundries around the country that have state-of-the-art pack rooms. We're starting to see an emergence of interest in the pack rooms for commercial laundries, and I think that we're getting more and more questions about the feasibility because of the cost that savings that can be recognized with the reusable program. I think hospitals and commercial laundries now are starting to look at this as an opportunity for them to provide a greater service to the hospitals. So you need to make sure, though, that you have those conversations with the laundry, and by letting them know that there is an interest, I think that many of them are sitting on the fence right now. Can they get the interest from the peri-op departments to make the investment in the laundry processing or a pack room?
Okay. Another question from an attendee. Our greening initiative has been approved. However, it is budgeted out so that we only receive a certain amount per quarter. What should we start with? And are there certain items that would be best to switch at the beginning of the campaign over other items? More important items first, down to least important items last.
Yeah, two things come to my mind. I mean, we often see, as you saw in the examples that I presented in the program, that many of these facilities included the gown first. They use that as sort of their test run. Gowns are easy to pack separately, individually, or easy to put into a pack that's pre-established. And that's a really good place to start. The other thing that I think about, though, is if you're having issues in your department with those back table covers tearing because of instrument trays can be so heavy nowadays, look specifically at what challenges you may be having in your institution with your disposable, whether it's drapes or gowns. And I think that that's a good way to tackle an area where you're having a challenge and provide a solid solution. So you may gain a little bit more interest and support internally if you're providing or looking to provide a solution for a problem that already exists.
Okay, thank you for that. Where do you recommend finding the information, beside this webinar, of course, to help build a case for changing from disposables to reusables in our own facilities?
Yeah, AORN is a good resource. Practice Green Health, their entire focus is on sustainability, and they have a lot of work and articles available that support the shift to reusable items. And then looking at things like these life cycle analysis studies as well. They're very, very complex and detailed, but provide a lot of good information and opportunity. Lastly, I would really encourage you to reach out to colleagues. I know the AORN conference is coming up this next week. I know we're leaving on Sunday to attend. You will have participants there, attendees there who have done this in their facilities. And I always say that's a great place to start because they can give you firsthand experience and help you to understand what they've gone through in order to make this transition.
Okay, just received a question from an attendee. In the past, when using cloth gowns, there was the issue of strike-through. How would that be any different now? Well,
what I would say is whenever I hear strike-through, I would like you to go back to the barrier protection levels. You remember that those barrier protections are set based on the exposure to fluids, moisture, spray, etc. And whenever I hear strike through, what that tells me is that probably you do not have the right level of barrier protection for the amount of exposure, the type of exposure that you're getting. So that would be my suggestion, is first go back and see what level of protection did you have. And if you're getting significant strike through, chances are you need to up your level to maybe from a level 3 to a level 4.
Okay, another question is, which disposables of those covered today would you say are a good starting point for implementation of a reusables program?
If I'm understanding that question, is that similar to the question of what would we start with first?
I think it may be, yes.
Yeah, so I would go back to the gowns are simple, and that seems to be historically a good place where folks start, but also looking at any issues you may be having with tears and drapes or whatever, back table covers, etc.
Okay. Do you find that it may be more difficult to implement a reusable program in an ambulatory facility?
Personally, I don't see what the difference would be, whether you're ambulatory or in an acute care setting from a linen management perspective. They still have a commercial laundry processor, and the same processes would apply. We have the same standards for barrier protection there, and for how we do things in those facilities. So I think the same procedures would apply.
Okay, and at the end of a reusable gown's life cycle, is there any associated disposable costs?
There may be, and that's something that can be figured. What we find often is that sometimes those items that are at the end of their life cycle actually are recycled, if you will, out into other places. There are also businesses that will purchase items that are either damaged, stained, and they have what they call rag outs, and they actually can recycle, reuse those items for other purposes. So it just depends on your facility and what arrangements can be made in your community for, do we need to dispose of those, or can we actually rag them out and put them into circulation for some other use?
Okay, that's great. Thanks, Angie. We haven't actually received any more questions. So thank you for such a great webinar, Angie. Just a reminder that one lucky attendee today will win an Amazon gift card for completing the post-webinar survey, which will appear on your screen shortly. If you do not see the survey, please email us at webinar@mdpublishing.com. For information on our upcoming OR Today webinars, please visit our website, ortoday.com/webinars. Thank you again today to Angie and for everybody attending, and we hope you have a great day and hope to see you next time.